Welcome to Impact by Diffa Dallas, the official podcast of the Dallas chapter of the Design Industries Foundation Fighting AIDS. We'll share valuable info about the fight against HIV and AIDS, what our organization is doing to assist those in our community, and most importantly, how you can help us make a real impact.
Hello, everyone. Thanks for tuning into this episode of Impact. I'm your host, Shane Allen. Today, we're talking about PrEP, pre-exposure prophylactic. It's a very long and a very fancy word, which is why we shortened it to PrEP. And to talk about PrEP, I've brought in Colin Quinn. He's the CEO of Included Health. He's joining us via Skype from New York. Colin, thanks for joining us this morning.
Good morning, Shane. Glad to be here.
So first of all, tell us a little bit about Included Health, this company that you've started.
Yeah, absolutely. So about a year ago, started Included Health, and what we do is we are a LGBTQ plus focused healthcare company to support employees at our partner organizations to really assist in any healthcare need or aspect that they might have. So as I'm sure many of us are aware, the healthcare system necessarily has not catered or been set up to really assist those of us in the community with our needs, whether it be a high rate of discrimination, to a lack of access to quality care and just navigating the overall healthcare system. So really that's what our services are designed to do, is really support members of the community in whatever sort of healthcare need that they might have.
Very cool. And it's worth noting that neither I nor Colin are doctors. And we are very familiar with PrEP. We can speak to it intelligently, but you should always seek the advice of a medical professional when talking about any sort of drug that you need to take, or anything medically for that matter. So PrEP, pre-exposure prophylactic, the main job of PrEP is to prevent the transmission of HIV from one person to another. It's mainly for men who have sex with men, so bisexual and gay men. Truvada was approved back in 2004 by the FDA. It's been around for a while, and the drug maker Gilead has now created a newer version called Descovy. It does the same thing. It just works a little differently within your body. The pill is a little smaller, so both of those are available. I want to start with a story, actually, and it's a crazy one. So I have a friend who moved to a new city and got a new doctor, and had heard about PrEP. 9 in 10 gay and bisexual men have actually heard about PrEP. Only 35% of them use it, according to the CDC. We'll talk more about that in a minute. But he had heard about PrEP. He'd heard his friends talking about it. So he asked his doctor about it. And his doctor had no idea what he was talking about, which at the time, in 2019, was absurd to me, since Truvada had been around since 2004. What should someone do, Colin, if they're faced with a situation like that?
Yeah, it's a great question, and it's an unfortunate circumstance. To your point, there are so many members of the community who are wanting to get on PrEP and have those conversations with their providers, but unfortunately, many providers, sometimes it's geographic based, sometimes it's more healthcare institution based, depending if they're affiliated with a religious system and things like that, to where having those conversations become a little bit more difficult and limited. I know some of our members that we work with today through our services, depending on which part of the country they live in, they've been fearful or had those difficulties bringing up the conversation with their providers, or they themselves, sometimes even members of the community, aren't as knowledgeable about it, or they might have heard of it, they might not have full information. So I think there's really an information gap, both from a patient and provider standpoint, that really one that we're looking to bridge that gap from our services perspective. But I think there's a lot that we can do just from an overall education awareness for members of the community and provider community.
Sorry, go ahead.
So I was going to say, just to answer your question, as far as if a individual is faced with that situation, or really if they're wanting to have that conversation with their doctor, I think there's a couple different ways to go about it. I think on one hand, patients or individuals find they might be fearful in having that conversation. So you always want to have a somewhat of a safe and welcoming environment. So if that is a potential limitation if you're just unsure, if you've not necessarily been open about your sexual health with your provider. I would highly encourage you to start having those conversations, because speaking openly about your sexual health is really important to your overall health and well-being, but fully understanding that there are some instances where you might not necessarily feel comfortable in doing so. So what we recommend doing is to do this almost in like a safe and anonymous way. One thing that you can do is call your office from the safety and comfort of your own home, and maybe talk to a nurse that who's on staff and ask that question. You don't have to divulge who you are, but just ask the question, hey, does Dr. So-and-so treat members of the community? Does he or she prescribe PrEP? Are they knowledgeable about what PrEP is? So that's one quick, easy way that you can do it. If you are open about your sexual health and history with your provider, absolutely, I would recommend bringing that up, because if you're already talking to them, if you're already out to them as a gay male or bisexual male, this should have come up in conversation from the provider standpoint. To your point, Shane, they might just have not been knowledgeable or as aware of it. It's not saying that they are against it or treating members of the community or prescribing it. There just might be a provider education gap. So there's a couple things that you can do there. I know in some of my instances, I've lived on the West Coast and the Midwest, and now on the East Coast. I've actually had to be that educator to my provider about PrEP, to say, hey, doc, do you know anything about PrEP? No. Okay, well, I'm interested in getting on it. Here's what I know about it. I had some information. I think I pulled up Gilead on my phone, and we walked through it together. And then really that gives the opportunity to open that conversation up, and then really force that provider to do a little bit more education on their part. I know it's an unique time, but there should be a Gilead sales rep. Hopefully that is maybe seeing that provider office. Now, I know some offices are not seeing reps and things like that, but you can ask that question, hey, do you have a Gilead sales rep who is knowledgeable on PrEP, Truvada, Descovy, that they can get some more of that information and educate themselves from a provider standpoint as well. So I'd say there's a couple opportunities there. Those are just a couple quick things that come to mind, but I'm sure there are a couple others as we have conversation that we can talk about as well.
Yeah, and Gilead, of course, the company that created Truvada and Descovy, did a lot of that research. And that's a really good idea, actually, that I never thought about, just kind of cold calling your doctor or doctors to see who is knowledgeable on PrEP. It's something I'd never thought of. You know, PrEP has a 99% effective rate of preventing HIV transmission. So that's really good. But that being said, you know, of 9 in 10 gay and bisexual men know about it, only 35% take it, but not everyone should be taking PrEP, right? You may not be a good candidate for it.
Correct. Yeah. So I would say there's a couple things. And once again, I think this gets into the point, you and I are not medical professionals. So it's always best to have that conversation with your doctor or medical professional to determine, are you the right candidate for PrEP? I know when it originally came out, it was really targeted for those that are in high risk situations. So maybe individuals, I think from injection or needle use, but also from a sexual activity and high risk situation there. But I think more and more providers are saying, hey, if you're a gay male or bisexual male and you're having sexual encounters with other gay men or bisexual men, it might be a good idea for you to go on PrEP, just to limit your overall exposure or transmission chances. Clearly, there are some toxicity concerns with Truvada, where from a liver and kidney function and bone density, that this is all captured in the clinical trial data, and the provider should be knowledgeable on this. But that's why they do every 3-month lab test. So they do blood work every 3 months for you to be able to renew your prescription. And they're checking for those things. How is your kidney and liver function? Just to make sure that the toxicity or if the impact of PrEP or Truvada is not having a negative impact on your overall body. And if it is, then you can be removed from taking that prescription. But that's something that the medical community should be tracking and monitoring on your behalf to ensure it is safe for you to be able to take.
Yeah, and you're talking about sexual activity, it's important to note too, and what your doctor will tell you, at least mine told me, and I have told friends of mine, that just because you take PrEP does not mean you should stop wearing condoms. This is just another tool in your toolbox to
Correct.
prevent the transmission of HIV. Condoms are imperfect, they break, things happen. So this is just another step to protect yourself and others. What if you run into a situation? I had another story happen actually last week. The CFO of a company reached out to me and said, we were interviewing a new hire. They asked if our medical insurance provider, covers PrEP. I checked and it doesn't. What should someone do in that situation?
That's interesting.
I thought so too in 2020.
I'm really surprised by that because I would imagine most insurers and health plans cover it, especially because it's been out on the market for so long and really there is no other option for members. But the good news is Truvada is going off patent or generic effectively September of this year. So really next month, it'll become generic. There will be a generic equivalent option on the market. I think Teva Pharmaceuticals will be the generic manufacturer of that. So that should reduce the price. And once drugs go generic, typically they become covered by most all plans, if not all, in that situation. So I think there are some good opportunities there. Second, Gilead, because it is a very expensive drug to take. I think the average list price is probably $1,500 a month or plus now by that point if it's not covered by insurance. So what Gilead has done is they have a copay card where if you are paying out of pocket or have a high out of pocket cost associated with the drug, then they absorb a lot of that for the patient. So it lowers the overall out of pocket cost. So I'd say that's one option for you if it still is not readily available and covered by insurance. Two is sometimes there are local LGBT resource clinics, depending on where you live. Sometimes the medication and the cost of medication is subsidized depending on what your income limits are and thresholds there, to where it could be covered as well from that standpoint. So I'd say there's a couple things out there from a financial assistance that can assist members who don't have coverage for it. And then also the other good thing is it should be going off patent and having a generic equivalent option available here in the next couple months.
Yeah, that's a good point. So, just to recap everything for everyone that we've talked about, PrEP exists. It's 99% effective, which is excellent in reducing the transmission of HIV. If you're not taking it, the likelihood is if you're a gay or bisexual man, you know about it. If you didn't know about it, now you do. You're welcome. But if you're not taking it, ask yourself the question, should I be taking PrEP? And at least have the conversation with your doctor. At the very least, have a conversation with your doctor. If your doctor doesn't know about PrEP, find one who does, or do what Colin did and use that as an opportunity to inform that doctor. Google it, bring it up on your phone and talk to him or her about this as an option for you. If your insurance doesn't cover it, check out the cost assistance programs and the coupons provided by the manufacturers. Double check with your insurance next month to see if the generic version of Truvada might be available. Lots of options for you. At the end of the day, the CDC says that this is a very underused drug with only 35% of the gay and bisexual population using it. So definitely worth having that conversation with your doctor, because what a great story to be able to tell that you were part of the first AIDS-free generation with this mixture of PrEP and antiretroviral therapy that gets people living with HIV to undetectable status. The transmission rate is nil. Mm-hmm. So there's really no reason not to have a conversation. Colin Quinn with Included Health, thank you so much for joining us. We really appreciate you taking the time.
Absolutely. Enjoyed it, and thanks for having me.
And if you want to learn more about PrEP or anything regarding HIV and AIDS, feel free to reach out to DIFA Dallas at diffadallas.org. We're happy to connect you with an AIDS service organization that can help you, or we can even answer those questions. Thanks for watching.